The Essential Guide to Feline Leukemia for Cat Enthusiasts. Feline leukemia virus, FeLV, is one of the most significant viral infections that affects domestic cats worldwide. As a cat enthusiast, it's crucial to understand the nature of this disease, its symptoms, treatment options, and the preventive measures that can be taken to protect your feline friends. This comprehensive guide aims to provide a thorough understanding of FeLV, from its biology to how it affects your cat's health, and what you can do as a responsible pet owner. What is feline leukemia? Feline leukemia virus, FeLV, is a retrovirus that compromises a cat's immune system, making it susceptible to other infections and certain types of cancer. Unlike some other viruses, FeLV is not typically transmissible to humans or other animals like dogs. It is, however, highly contagious among cats, and once infected, a cat's life expectancy can be significantly reduced, depending on the stage of the disease and the effectiveness of the treatment. FeLV affects a cat's ability to produce healthy blood cells, which leads to a weakened immune system, anemia, and potentially life-threatening infections. It is also linked to an increased risk of developing various types of cancer, including lymphosarcoma and leukemia, both of which are serious conditions. How is feline leukemia transmitted? FeLV is primarily spread through close contact with an infected cat. The virus is found in the saliva, urine, feces, and blood of an infected cat. The most common ways the virus is transmitted include 1. Biting. Cats that fight and bite each other are at a high risk of passing FeLV. 2. Grooming. Cats that groom each other or share a water or food bowl can also spread the virus, especially if one of the cats is infected. 3. Maternal transmission. FeLV can be passed from an infected mother to her kittens, either during pregnancy, through the placenta, or through nursing. 4. Close contact. Although less common, FeLV can be transmitted through casual contact between cats, especially in environments where multiple cats live together. Signs and symptoms of feline leukemia. Feline leukemia virus affects cats differently, and some infected cats may show symptoms only after years of living with the virus. However, it's essential to watch for signs that may indicate the presence of FeLV. These can include 1. Weight loss. A gradual or sudden loss of weight can be a key indicator. 2. Lethargy. A noticeable decrease in energy and interest in activities. 3. Anemia. Signs include pale gums, weakness, and a lack of stamina. 4. Chronic or recurring infections. FeLV weakens the immune system, leading to frequent infections such as respiratory or skin infections. 5. Fever. A persistent fever can be a sign that the body is fighting an infection. 6. Gastrointestinal issues. Vomiting, diarrhea, and changes in appetite can occur. 7. Coughing or difficulty breathing. These symptoms could point to a respiratory infection. 8. Eye problems. In some cases, eye issues such as uveitis, inflammation of the eye, or retinal problems may occur. 9. Swollen lymph nodes. Enlarged lymph nodes may be a sign of an immune response to the virus. 10. Cancerous growths. Lymphoma and other cancers are commonly seen in cats with FeLV. It's important to note that not all cats with FeLV will exhibit all of these symptoms. In fact, some cats may appear to be perfectly healthy for months or even years before showing any signs of illness. This is why routine vet visits and early testing are so critical. Testing for feline leukemia. FeLV can be diagnosed with a blood test. The most common tests used to detect the virus include 1. ELISA, enzyme-linked immunosorbent assay. This test detects FeLV antigens in the cat's blood. 1. A positive result typically means the cat is infected with the virus. 2. IFA, immunofluorescence assay. This test is used to confirm a diagnosis after an initial positive result from an ELISA test. 2. It detects the virus in the cat's bone marrow or blood cells. Testing is often recommended for all newly adopted cats, as well as for those showing signs of illness. It's also important for cats who live in multi-cat households or outdoor cats that are at a higher risk of exposure to FeLV. Stages of FeLV infection. FeLV is often divided into 3 stages based on how the virus interacts with a cat's immune system. The stages include acute infection. In the early stages of infection, a cat may show no symptoms or only mild symptoms. During this stage, the virus is actively replicating, and the cat can spread the virus to other cats. Some cats may develop mild fever or respiratory signs, but many may seem fine. Subclinical infection. In this stage, the cat may appear healthy, but the virus remains in the cat's body, affecting the immune system. A cat with a subclinical infection can still spread FeLV, but they may not show overt signs of the disease. Some cats will clear the virus naturally during this stage, while others will progress to the next stage. Persistent infection. This is the most severe stage, where the virus has spread throughout the cat's body and the immune system is severely compromised. At this point, the cat is at high risk of developing secondary infections, anemia, and cancers. The cat's life expectancy is significantly shortened in this stage, and supportive care becomes essential. Treatment options for feline leukemia. Currently, there is no cure for FeLV, but treatment options can help manage the disease and improve the quality of life for affected cats. These treatments may include 1. Antiviral drugs. Medications such as interferon may help slow the progression of the disease and reduce viral replication. However, these treatments are expensive and not universally effective. 2. Supportive care. This may include administering fluids for hydration, medications to treat secondary infections, and supplements to boost the cat's immune system. 2. Cats with anemia may require blood transfusions. 3. Managing cancer. If the cat develops cancer, treatments such as chemotherapy or radiation therapy may be considered. 3. These are intensive treatments that may improve survival rates but often come with side effects. 4. Pain management. For cats suffering from cancer or secondary infections, managing pain is an important part of treatment. Cats diagnosed with FeLV should be kept indoors to prevent transmission to other cats and to limit exposure to stressors or infections. Regular veterinary checkups are essential to monitor the cat's condition. Preventing feline leukemia. The best way to protect your cat from FeLV is prevention. Here are several steps you can take. Vaccination. A FeLV vaccine is available and is highly recommended for all cats that are at risk of exposure. This includes outdoor cats, multi-cat households, and cats who may be exposed to infected strays. While the vaccine does not provide 100% protection, it can significantly reduce the likelihood of infection and severity of the disease if exposed. Keep cats indoors. Keeping your cat indoors minimizes the risk of exposure to FeLV, as the virus is primarily spread through close contact with infected cats. Indoor cats are also less likely to be injured in fights, further reducing the risk. Test new cats. If you are introducing a new cat into your household, especially if it will interact with other cats, make sure to have them tested for FeLV. If a cat tests positive, discuss your options with your veterinarian. Minimize exposure to stray cats. Stray cats are often at higher risk of FeLV and other infectious diseases. If you come across a stray cat, try to avoid direct contact with it or any of your pets until it has been tested for FeLV. Spay, neuter. Spaying or neutering your cats can help reduce the risk of fights and aggression, both of which are common methods of FeLV transmission. Living with a cat infected with FeLV. If your cat tests positive for FeLV, it's important to provide them with the best possible care and a stress-free environment. Cats with FeLV can live for many years, especially if the disease is detected early and the cat is given proper care. Here are some tips for managing the health of a cat with FeLV. 1. Provide a stress-free environment. Stress can weaken a cat's immune system, so create a calm, quiet living space. 2. Regular veterinary care. Frequent checkups are essential to monitor for infections, anemia, and other complications. 3. Healthy diet. A balanced diet rich in vitamins and nutrients can help strengthen the immune system. 3. Consult your vet for recommendations on food specifically formulated for cats with compromised immune systems. 4. Avoid exposing other cats, Keep your FeLV-positive cat indoors and away from other cats to prevent the spread of the virus. Conclusion: feline leukemia is a serious disease that can impact the health and lifespan of infected cats. As a cat enthusiast, understanding the transmission, symptoms, testing methods, and treatment options for FeLV is essential. While there is no cure for the virus, early detection, appropriate treatment, and preventive measures can help improve the quality of life for infected cats and reduce the risk of transmission to others. By staying informed and proactive, you can ensure that your feline friends lead happy, healthy lives.